So yes, thank you for the introduction, and I'll be presenting the ethical considerations for the inclusion of PROs in clinical research and the PRO ethics guidelines. So first, I want to note that whilst I was involved in this project, this was led by Dr. Samantha Cruz Rivera, Professor Melanie Calvert, and others at the University of Birmingham on behalf of a large team. And I'd also like to thank the co-authors. This is the publication which appeared in JAMA earlier this year. As you can see, it's quite a long list and they were all involved, so it's not just me. And I'd also like to note a funding statement and disclaimer. So the work was sponsored by the University of Birmingham in the UK and funded by these funders here, NIHR, UK Research, and others. There were some people involved in the Delphi panel who were from regulatory agencies, and obviously the views are not necessarily the views of the regulatory agencies and others. And here, this is an ethics conference, so there was someone involved who is a executive deputy editor of JAMA, but was not involved in the decisions of the paper's acceptance. And so first I want to begin by talking about the importance of developing these guidelines. And there have been recent publications that highlight the different ethical issues with the use of patient-reported outcomes, or PROs, in clinical research. In particular, that reporting of results is not very adequate, and systematic evaluations have indicated that many trials tend actually just not to report these results at all. And in one study, 30% of the included trials failed to report data in their PR data in their publication. So the emission of PR data of approximately 50,000 participants was not included. And obviously this is a major problem because patients are giving this data in the hope that it will actually inform research. But if it's not reported, then that's very difficult. And a qualitative study amongst research nurses and trialists showed the lack of guidance on how to manage concerning levels of PR data. And concerning levels of PR data refer to extreme scores reported on domains, for example, such as psychological distress or physical symptoms requiring immediate attention. The lack of guidance will affect both patients and researchers. Patients may think that PRO data reported can inform their clinical care, but if the data are disregarded, then this is not true. And also researchers may feel emotional or ethical burdens when they collect this concerning data and they're not certain about how to provide the best care. There was a further ethical issue highlighted in a recent Nature Medicine publication, and that's with regard to the inclusion of underserved groups in PR research. In particular, people who may come from minority groups, people who have disabilities, or people who have low literacies are not always included in PR research. And this is a major challenge because we don't want people to be underrepresented in this research because their views should also be heard. Now, there is an existing guidelines for the inclusion of PROs in clinical trial protocols. This is known as the Spirit PRO guidelines, the Spirit PRO extension, and I put up the information on the publication here. However, whilst this extension does provide guidelines for the inclusion of PROs in trial processes, there aren't any ethical considerations included, resulting in something of a gap. And here I'm going to try to play this video, and this is the voice of a patient and the importance of the PRO ethics guidelines from their view. So I'm just going to test it, and please let me know if you don't hear it, because I would very much like this included in the presentation.
PROs are a crucial evolution in clinical research.
Can I just stop? Can everyone hear that? Is that good? Yes?
Yes, we can hear it.
Excellent. Okay, I'll continue. Sorry about that.
They can change the focus of research clearly onto the patient, when today it is most usually on the treatment, the drug, and the response it gets, or the physical intervention, or the way it is delivered, always on costs, both financial and in terms of resources. Now that has to change. The patient must be the focus. However, PROs are largely unregulated. I'm not saying that regulation is a good thing or a bad thing, but it does raise particular issues, which are very valuable, about protecting patients, about safety. And it is probably in the area of PROs as much about ensuring clarity and transparency as it is anything else. Now, we need researchers to be clear about what we, the patients, must do to help ensure that PROs are effective research tools. It is our data that will be gathered, so we need to know how it will be used and safeguarded. And how can we be sure that the data which is gathered is of the highest quality, can be analysed properly and used, because that is what will help clinical and care practice to improve change. Now, these all underpin the ethical context of PROs.
Okay, so thank you. That was a really valuable perspective. And now, following the Equator Network guidelines, the PRO ethics guidelines were developed. In the first step, there was a list of candidate items generated through systematic review describing the ethical implications of PROs in clinical research. This review identified 23 candidate items. A 2-round Delphi exercise was then conducted. In the first round, there were 96 international participants scoring the 23 items based on a scale of 1 to 9, where 1 to 3 was not important, 4 to 6 important but not critical, and 7 to 9 critical and important. In round 1, participants had the opportunity to recommend candidate items to be considered and scored in round 2. In round 2, 85 participants scored 32 items, 23 original candidate items and 12 additional items were, 35 were suggested in round 1. And finally, an online international consensus meeting was held to anonymously vote on the inclusion or exclusion and further discussion on each item. The international participants included bioethicists, members of ethical review boards, patient partners, journal editors, PR researchers, and regulators. There were main topics addressed by the 14 items were first, the background and rationale and methods of the trial design for PROs, any specific eligibility requirements such as language and literacy, the data collection plan, the administration of PROs in the setting, monitoring PRO data for concerning responses, minimizing barriers to PRO completion to promote patient inclusivity, addressing patient acceptability and burden, alternatives to completion of PRO questionnaires when participants could not self-report, including patients and members of the public to give input, mechanisms to minimize missing PRO data, and plans to disseminate PRO findings. So these guidelines aim at highlighting ethical issues that should be considered by researchers prior to submitting research to ethical boards, and for members of ethical boards to consider and to make notes when reviewing the research. This tool can be tailored to the user's needs. And as you can see, there is a rationale column here on the slide, and these PRO ethic guidelines align to justifications using established principles, theories, and values, and they also consider individual and societal welfare, as the slide shows. The rationale column aligns with the 4 biomedical ethical principles: autonomy, justice, beneficence, and non-maleficence, and 3 ethical principles of the Tri-Council policy statement, which are respected persons, concern for welfare and justice. Research ethic committees or institutional review boards' function is to protect rights and welfare of participants, and in developing the guidelines, we believe that individuals involved in PR research can assist in this. Additionally, the PRO ethics guidelines are important as they will help promote and disseminate high-quality research, maximize research resources, and minimize research waste. They can also protect participant and researcher welfare and minimize participant burden and harm. Now, the PRO ethics guidelines were published in May of this year in JAMA. And if you're interested in reading the full article, you can see in more detail how the guidelines were developed and the content of each of the items included. And here's a QR code if you'd like to scan it to access the paper. And currently, the team is working on the implementation and working with different institutions to promote adherence to them. At present, the team in Birmingham are in discussion with the Canadian and Japanese departments of health to promote guideline implementation. The guidelines are currently being translated into Japanese and Spanish, and the team are working with patient and members of the public to help promote the guidelines and develop their summaries, as well as develop training courses for RECs and IRBs, and considering ethical educational courses that include these guidelines. They're also presenting at international conferences such as these. And in summary, the ethical guidelines aim to improve the quality of PRO clinical research, protect participant autonomy, protect participant and researcher welfare. It's an adaptable tool to address and highlight ethical considerations specific to PROs. And Dr. Cruz-Rivera encourages you to reach out if you would like further details or are interested in helping to disseminate. And there were a large number of international collaborators, and I would like to thank everyone who was part of the project for their invaluable contributions to the work. And lastly, Dr. Amanda Hun was one of the co-authors and sadly passed away this year during the development of the guidelines, but we would like to acknowledge her memory and contribution. So thank you very much.